Hello, everyone. Those are patients and friends from Comprehensive OB-GYN. It is Dr. Carlos Jurado, and now we are making use of technology, and we want to reach out to you and give you periodic pairs on education and information of obstetrics and gynecological conditions that will help you to make good life decisions. And when you come here to our office, we will be available to help you. And today we're going to talk about uterine fibroids. It's a very common condition in the female. And what are uterine fibroids? Are benign tumors of the uterus. How often it happens? I will say that 75% of women have at least one tiny uterine fibroid. However, only 20% of women get problems associated with the fibroids. They can grow very large. You can develop multiple fibroids. They can be in any area of the uterus, inside the cavity, within the walls, in the surface, or even hanging from pedicles that we call pedunculated fibroids. So they can be all over the uterus. A woman can have one, or a woman can have multiples. My record number of fibroids removed out of the uterus is 42 fibroids. So sometimes they come accompanied with many gynecological problems like irregularities of the menstrual bleeding. You might experience heavy menstrual flow, painful, or irregular menstrual flow. Sometimes they are so big that they affect because they put so much pressure on your pelvic floor. Sometimes they are causing problems with fertility. Not always. I've seen many women with big fibroids having babies, but in many cases, you will have issues to conceive or to get a healthy full-term pregnancy. So what we do with these fibroids? So how we recognize them? Typically on pelvic examination, we can palpate if your uterus is enlarged or irregular. And then we do an ultrasound, and pretty much that makes the diagnosis. So how we treat them? Treatment depending on what is the age of the female, what are her reproductive plans. You know, if a woman still want to have babies, we cannot take out the uterus, right? So we have to do conservative treatments in many instances if the woman wants to have babies in the future. And that includes uterine artery embolization or surgical removal of the fibroids, what we call a myomectomy. If the woman has completed a reproductive life, then we consider removing the whole uterus. Because remember, the uterus is only good for reproduction, and the next thing is just to give you trouble. So if you are not going to have any more babies, then and your fibroids are giving you so much trouble and affecting your quality of life, you should consider take the fibroid out or take the uterus out. When we do these surgeries nowadays, we approach them with laparoscopic, minimally invasive approach using the Da Vinci robot, very high tech, okay, that will reduce time in the hospital, reduce the time of recovery. So you go back to your regular life faster. However, if you let these fibroids to get so big, then we have to open. So don't delay. Come to see us if you feel that you might have fibroids and get the full consultation so you can see and explore all your options.